Hi Carlos, how are you?
Good.
Have you step on over here to the scale for me? Okay, great. All right. Have you remove your shoes and step over here to the wall? So how old are you now?
18.
18. What grade are you in?
12.
Senior. Playing any sports?
No.
No sports. 7 inches tall. Go ahead and pick up your shoes and bring them in here. You can just set them down right there. Great. Have you get up on the table for me? Carlos ambulates with a steady gait and smooth movements. He appears clean, well groomed. He doesn't appear to be in any distress. He seems comfortable. His hearing seems to be intact. He's responding appropriately to stimuli and conversation, and his speech is clear and understandable. All right, Carlos, today we're going to go ahead and do a complete assessment. So it's going to be head to toe. Do you have any questions for me before we start? All right. I'm going to go ahead and start at the head, and we're going to go ahead and feel your head, okay? Have you noticed any lumps or bumps or anything?
No.
Okay. Carlos's head is symmetric, no bumps or depression noted. Hair pattern, he has short, thick brown hair without any flakiness or infestations. It's a good hair pattern with even distribution. We're gonna do some fun stuff now. Have you go ahead and smile. Show your teeth. Frown. Okay, have you puff out your cheeks. Okay, and have you close your eyes. Don't let me open them. And raise your eyebrows. Okay, you can open your eyes. So cranial nerve 7 is intact. Do you have any sinus problems?
No.
Okay, I'm going to go ahead and feel your sinuses. Let me know if you have any pain or tenderness. Any pain or tenderness? All right. Any pain or tenderness? No pain or tenderness noted. Carlos's skin is warm and dry. I'm going to go ahead and check for your skin turgor right underneath the collarbone. Skin is elastic, immediately, no tinting noted, immediately returns to position. Can I take a look at your nails? All right, looks like you've been eating some Cheetos. Nails are smooth. He does bite his nails. Capillary refill is less than 2 seconds. All right, Carlos, do you wear contacts?
Yeah.
Okay, you have those in today? So Carlos is wearing his contacts. We're going to go ahead and do a few eye exams, okay? A few eye tests. When was your last eye exam?
About 2 months ago.
Okay, you got it all done over the summer. This is called the cover uncover test. I'm going to have you look at my nose, and I'm going to have you put this over one eye. Okay, perfect. And take it down. And blink a few times and put it over the other eye. Okay, great. Carlos has a steady fixed gaze. You can let that go. Carlos has a steady fixed gaze. We're also going to do a 6 signs of cardinal gaze test. And what I want you to do is I want you to look at the pen light, and I don't want you to move your head. I want you to follow it with your eyes only, okay? Carlos tracks the pen light parallel with both eyes, no nystagmus noted. I'm going to take a look inside your eyes now. Is that okay? All right. The cornea are clear, no lesions noted. Iris appears flat and round. Corneal reflex symmetric in both eyes. Pupils are round, equally reactive to light and accommodation. I'm going to actually take a look inside your eye. We're going to get kind of close, okay? Blink if you need to. Red reflex is present. I'm going to do the other. Red reflex present. All right. There's no cloudiness or dark lesions noted. Have you look up for me? I'm going to pull your eyes down just a little bit. Sclera is white, no jaundice or redness. The conjunctiva are clear. The visual field or confrontation test has been deferred as my visual field is not completely intact. All right, I'm going to go ahead and take a look at your ears. Carlos's ears are equal bilaterally. There's no swelling or thickness. The external ear appears debris-free, no lesions, no redness. Are you having any tenderness or pain in your ears? Okay, just going to feel a little bit. Any pain or tenderness? No pain or tenderness. I'm going to take a look inside your ears. Have you tilt your head just a little bit? All right, great. External canal is clear, no redness or swelling noted. I'm pulling up and back on the pinna. There's a little bit of cerumen noted. The tympanic membrane is clear, translucent rather, with a pearly gray. It's shiny with a cone light reflex present. I'm going to go around to the other side. You tilt your head to that side. Perfect. Pulling up and back on the pinna. Again, a little bit of cerumen, but no swelling or no swelling or redness. Tympanic membrane is clear or translucent with pearly gray. Cone light reflex noted. We're going to do what's called the whisper test. Okay, I'm going to have you close your eyes. I'm going to say a combination of 3 letters and numbers, and I want you to repeat them back to me, okay? So go ahead and close your eyes.
P4.
Correct. Now the other side.
A7N.
Perfect. Whisper test. Carlos is a 3 out of 3 bilaterally. We're going to move on to the nose. Carlos's nose is symmetric. It's midline. It's appropriate with the other features. I'm going to take a look inside your nose, so I want you to look just straight at me at first, and then I'm going to have you tilt your head back, okay? A little uncomfortable. All right, and have you tilt your head back. Mucosa is pink or red, no lesions noted. It's nice and moist. Turbinates do not appear injected, or there don't appear to be any polyps. I'm going to check your nose to make sure that they're patent. So have you take a breath? Okay. Nares are patent bilaterally. I didn't note any discharge. Have you been having any problems with that? Any runny nose or anything? Okay. Take a look at Carlos's mouth. His lips are symmetric. They're moist. There's no cracking noted. Have you had any problems with your mouth? Any lesions that you noticed? Anything like that? When was your last dental exam?
A month ago.
Okay, great. And any problems?
No.
Good. All right. Have you opened your mouth for me? All right. Teeth appear clean, white, evenly spaced. Buccal mucosa, an interior of lips, intact, pink, without any lesions. Dorsal aspect of the tongue has papillae as appropriate. Lift your tongue for me. Ventral aspect of the tongue is shiny and moist. Smooth. No lesions. Have you ever smoked?
No.
Great. All right, have you stick out your tongue again for me? And I'm going to depress your tongue just a little bit. All right. Tonsils are 1+ bilaterally. Open again. Sorry. Stick out your tongue. Have you say ah?
Ah.
Okay. And the soft and hard palate are intact, movable. You can close your mouth now. Sorry. Thank you. There were no lesions or white spots noted. The uvula raises midline with awe. I'm going to go ahead and take a look at your neck. Neck is again midline, as is the trachea. No deviation. I'm going to feel your pulses. Carotid pulses present bilaterally, 2+. They're equal. Just going to listen to your neck. Maybe hold your breath for just a moment for me, please. No carotid bruits heard bilaterally. I'm going to check, I'm going to feel around your neck. I'm going to check for any lymph nodes. Have you noticed any swelling?
No.
Okay. Have you been sick lately?
No.
Okay. Tell me if any of them are tender. Have you put your head down or your chin down? There you go. No lymphadenopathy noted. I'm going to have you, we're going to do your range of motion first. I'm going to have you shrug your, or lift your shoulders and try to push against. Okay, great. Muscle strength is a 5. Have you look up, look down, look your head left, and push against resistance. All right, and look right. and push. Okay. Actually, I'm going to have you do that one more time. I'm going to have you look that way. And when you turn back, try to push my hand. Okay. And look the other way. And try and push my hand. Okay. And have you do your head side to side, ear to shoulder. Perfect. Carlos has full range of motion with a grade 5 muscle strength. I'm going to have you swing around just a little bit so I can see if I can palpate your thyroid. Okay, go ahead and swallow for me. Carlos's thyroid is not palpable, but that is not an abnormal finding. Okay. All right, Carlos, we're going to move on to the chest. I'm going to start with the back. You can lift your shirt up if that's okay. All right. So the skin, he has some mild acne, but no other lesions noted, no jaundice, no pallor. I'm going to have you go ahead and take a deep breath in for me. Okay, he has equal chest expansion bilaterally. We're going to do a test called fremitus, where I'm going to have you say the word 99 every time I touch your back, okay? All right.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right. Fremitus was resonant and equal bilaterally. Now I'm going to be tapping on your back a little bit, okay? There's no dullness to percussion. It was resonant and equal bilaterally. I'm just feeling for crepitus. Carlos has no crepitus. You getting a little cold?
Yeah.
Carlos is getting some goosebumps. There's no crepitus noted, no lumps or masses noted. Chest diameter seems to have a 1 to 2 AP diameter. It is symmetrical. All right, we're going to move over. Oh, I need to listen to your lungs. All right. Just breathe regular. Turn it back over to the diaphragm. Take a little deeper breath. And a big breath for me. Okay. And one more. All right. Breath sounds were clear, no adventitious sounds noted. And I'm going to have you go ahead and turn around to the front for me, Carlos. I'm going to take a look at your chest. Lift your shirt up again.
Yeah.
So again, some mild acne, a few nevi noted, but no other lesions, no redness, no jaundice, no pallor. Skin is intact, no other lesions. So I'm going to do the same thing. I'm going to have you say 99 again, and then we're going to do the percussion, and then I'm going to listen again, okay? So go ahead and say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. All right. Carlos's fremitus was resonant and equal bilaterally, as was the percussion. There was no dullness to percussion noted. Heavy breathe normal. A little bit deeper for me. All right. Have you take a deep breath? Okay. And one more. All right. I'm going to listen to the heart while I'm here. Breath sounds were equal bilaterally, no adventitious breath sounds. Chest was strong, apical pulse in midclavicular line. S1, S2 heard, no S3 or S4. All right, Carlos, we are going to work on your upper extremities. So what I want you to do is I want you to, we'll start with the shoulders. Have you do a big circle. Okay, up and down. Okay, like it's good. We're gonna have you go back and forth. Okay, good. Move your elbows. All right, wrists. And make a fist, open, flail your hands, and put them closed. Okay, Carlos has full range of motion. I'm going to have you put your hands out, grab my hands, squeeze. Okay, equal grip strength bilaterally. I'm going to have you put your arms out. Hold them out. All right. He holds his arms out steady, no drift. Have you resist my pushing. All right, resist. All right. Have you turn your hands in, resist, and resist. All right. Have you go ahead and put your hands down, and have you go ahead and raise your hands, or raise just your forearm. No, from your elbow here. Arm wrestle. Good. Okay, and this one. All right. He has good strength equally, equal bilaterally, grade 5, and we're going to go ahead and do the deep tendon reflexes now, okay? While I'm here, I'm going to assess for any epitrochlear nodes. No epitrochlear nodes noted. All right, we are going to go ahead and start with the biceps. There you go. Have you relax your arm as best you can. All right. Have you make your arm arm go dead. All right. All right. Go ahead and relax. All right. And I'm going to assess for epitrochlear nodes over here. No epitrochlear nodes present. Okay. And we're going to do the triceps and have you just relax your arm. Relax it for me. There we go. Excuse me. And then have you relax your arm as best you can for me. All right. So Carlos has his deep tendon reflexes for his biceps, his triceps, and his brachioradial reflexes are 2+. They are equal bilaterally. I'm going to go ahead, if you'll just relax your arms here, and feel for your radial pulse. It's equal bilaterally. Pulse is equal bilaterally. Its regular pulse rate is 68, which are all within normal range. Have you had any pain in your joints at all? Okay, I'm just going to feel on your joints. Joint movement is smooth, without any crepitus or cracking. No nodules or masses. Joint size is even or equal bilaterally. Have you raise your arm for me? All right, great. And raise this one. Okay. So joint size is appropriate. There's no cracking or crepitation on joint movement, and no masses or lumps noted. No redness, tenderness, or swelling noted in any of the upper extremity joints. Okay, Carlos, now the next thing I want you to do is I want you to do what's called the Fallon's test. I need you to put your elbows up and put your hands down, pushing your wrists together. Do you know any pain or tenderness? Okay, you can go ahead and put this arm down. I'm going to keep this arm up. All right, go ahead and just relax it for me. I'm going to palpate the axillary or the axilla, looking for any nodes. Palpating the anterior and the posterior crease. All right. No masses or tenderness noted. And if you don't mind, Carlos, on this one, I'm going to actually raise your shirt a little bit so that I can show for video purposes. Any tenderness?
No.
Okay. no nodes or masses noted. All right, Carlos, so I also want to take a look at your breasts. I need you to raise your shirt for me a little bit. All right, so I noticed that Carlos has a little bit of gynecomastia, which is normal in adolescence during the puberty years. And so this should go away for you, all right? There's no lumps or swelling, no nodules noted. They're pretty equal bilaterally. While breast cancer isn't that common in males, it can occur. So I want you to go ahead and lay down for me if you don't mind. Going to remove your socks for future. All right. So if you don't mind, if you'll lift your shirt again, just to your belly so I can take a look. Okay. Abdomen is flat, it's soft, it's symmetrical, there's no lesions. Skin is normal for ethnicity. There's no jaundice, no pallor, no redness. Have you had any stomach problems lately? Any tenderness in your belly? What about when you run? Any pain on your sides? Okay, great. I don't know any pulsations at this point. Hair distribution is fine. He does have a little bit right there. I'm going to go ahead and listen to your belly for a little bit. Warm it up a smidge. Vowel sounds are present in all 4 quadrants. I'm going to listen for any vascular sounds. No vascular sounds noted. No bruise. All right, Carlos. Same as I did on your chest when I tapped on it a little bit. I'm going to go ahead and tap on your abdomen. Is that okay? A little dullness. It's timpani throughout. There was really no dullness noted. So I'm going to go ahead and I'm going to feel on your stomach a little bit. Okay? Looked. I've listened. Yes. So I'm going to do a little light palpation. Just going to feel on your belly. You tell me if there's any areas of tenderness. Anything tender in there? Okay, so I'm going to go a little bit deeper this time, okay? If it tickles, let me know, but it should be okay. Any pain or sore, tenderness? Ever had any abdominal surgeries? Ever had any surgeries?
No.
Okay. I don't feel any tenderness or masses. I don't feel any organomegaly. It's essentially a negative abdominal exam. Okay, normally at this point I would assess the inguinal area for femoral pulse and any inguinal nodes. We're going to defer that at this time. We're going to move on to the lower extremities. They appear to be symmetric. They appear to be equal in length. Skin doesn't appear to have any lesions. They're warm and dry. There's no edema noted. I'm unable, well, let me bend your leg, sorry. I can never find this pulse anyway. I'm unable to palpate a popliteal pulse, which there's nothing abnormal about that. All right, go ahead and relax your legs again, Carlos. Dorsalis pedis pulses are 2+, so they're strong, equal bilaterally. Posterior tibial pulses are strong and equal bilaterally. At this point, I'm going to do an Achilles reflex, if you don't mind bending for me and relaxing. All right, positive. Alright. 2+ equal bilaterally. Carlos has hair present on his toes bilaterally. Hair pattern on the legs is even distribution. The nails are smooth. They are trimmed short. Capillary reflex, or capillary refill, is less than 2 seconds. I'm going to go ahead and do the Babinski. I'm going to take the tip of the reflex hammer and go up the lateral aspect onto the ball of the foot. Plantar reflex noted. And plantar reflex noted bilaterally. All right. I'm also going to check the for clonus. I'm going to bend here, and if you'll just relax for me. And negative clonus reflex. Negative for clonus. I'm going to have you take this heel and run it down this shin for me. Alright, smooth and coordinated movement. And do the same with this shin. Okay, smooth and coordinated movements. At this point, I want you to lift your legs straight up in the air.
Both of them are.
One at a time, it's fine. Okay. Limited a little bit by the jeans, right? Okay, great. Now do that with I'm gonna lift your strap just a little bit. Do that with flexing the knee. Lift your leg up and flex the knee at the same time. Okay. And that one as well. Okay. Have you do it one more time for me? Okay. And again. Okay. Smooth, even movements of the joints. No cracking or jerky movement. The knee joints do not feel swollen. I don't know any masses in there. Are they tender at all? Okay. So I also want you to bend at the knees. Bend at the knees. And go side to side. Okay. And I already had you cross your legs. So that's great. And I'm gonna have you do a little sit up for me. Sorry. Do a little sit up for me without actually sitting up. Okay, no hernia or bulging noted of the abdomen. And you can put your legs down if you'd like. And I'm gonna have you look that way.
With my eyes
Oh,
on my head.
let me move the pillow, I'm sorry. And go ahead and look that way. Turn your head. And so jugular pulsation is noted. And have you turn this way for me? And jugular pulsation noted bilaterally. And the patient's about 30 to 45 degrees. Okay, and let me pull this under for you so you can sit up easier. Hold on just a minute. All right, and go ahead and sit up. And as the patient sits up, the jugular vein flattens and becomes invisible. All right, Carlos, so we're going to move on to the rest of the exam. I'm going to put the pillow back up here. So we're going to do some range of motion and muscle strength. I want you to kick out your feet. Again, smooth joint movement. Limited a little bit by his genes. Have you, let me see your feet. Have you point your toes and then towards your nose. Okay, and then side to side. And then other way. Can you point? Can you do it that way? Towards the outside?
Like this and that.
Yep, perfect. To the floor, point your toes, and then towards your nose, and then side to side. All right, and then let me see both feet. Push on my hands. Okay, and then push on my hands. Okay, push on my hands. Perfect. Push on my hands. Okay, push and push. Push and push and push. Okay, good. He has good range of motion with good muscle strength, grade 5. At this point, I'm going to have you stand up. I don't need him to stand up yet. I'm sorry. Go ahead and have a seat back down. We're going to do a sensation test. So I want you to keep your eyes closed, and I want you to tell me when you can feel me. I'm going to and just say now whenever you feel me touch you, okay? All right, close your eyes.
No. 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 No.
Sensation is symmetric and equal on the face, the arms, the hands. Oh, not the hands, I didn't do the hands. The legs and the feet. I want you to close your eyes. And I'm going to draw a number or a letter in your hand and you tell me what it, or I'll draw a number in your hand and you tell me what it is.
3.
Correct?
7.
Correct. All right. So, Gravesthesia, he correctly identifies the number drawn on his hand. And have you close your eyes. I'm going to place an object in your hand and you tell me what it is.
Pen.
Okay.
Key.
Okay. And stereogenesis, object in his hands, he correctly names the object. So Carlos, I want you to do a finger to finger test in which I want you to go I'm sorry, we're going to do the finger to nose test. I apologize. So I want you to go put your arms out. You might need to scoot to the side a little bit. There we go. Put your arms straight out. And I need you to close your eyes. And other arm. And you just continue to go. And you can increase in speed. Okay. He's accurate and smooth in his movements. He's coordinated. All right. You can put your hands down. Now for this one, I want you to touch your finger to your nose and then touch your finger to my finger, okay? So start with your finger on your nose. Either hand is fine. And then to my finger, nose, finger, nose, finger. Okay, other hand. Finger, finger, nose, finger, and nose. Okay, he again has smooth and accurate movements. What I need you to do now is, it's called a rapid alternating movement, where I want you to take your hands and I want you to touch each finger to your thumb. Okay, he is able to do that equal bilaterally in a rhythmic pace. And now I'm going to have you go ahead and stand up for me. And you can step down. All right. So I want you to go ahead and step over here for me and turn that way. So his spine appears straight. He's symmetric. His shoulders are symmetric. Hips appear to be equal. Doesn't seem to be any unevenness. Have you go ahead and bend forward a little bit for me. Go ahead and hang your arms and bend forward. Any tenderness, or was that tickly?
No, there's an ant.
Okay. Okay, so no tenderness noted. His spine appears to be straight with no abnormal curvature. Go ahead and stand up for me. All right. Have you go ahead and bend side to side. Great. Great. And twist. All right. Any pain? All right. Have you touch your toes? And no tenderness. Okay. Again, I didn't notice any abnormal curvature of the spine. Have you walk across the room for me? Again, a smooth, steady, smooth, even gait with coordinated movements. And go ahead and walk back. Walk back heel to toe, if you don't mind. He's able to maintain his posture and balance. Okay, great. And I'm going to have you come close to me. I'm going to have you stand there with your arms down by your side. feet together. And I'm going to have you close your eyes. We're just going to count for about 20 seconds. All right, you can open your eyes. Good job, Carlos. He's able to maintain his posture, no swaying, no off balance. All right, Carlos, so one thing I did forget to do was I forgot to check your knee reflexes. So I'm going to pull this out, and if you can sit back up on the table for me. All right. I'm going to push this in just a little bit so I can get your legs to hang. All right. All right, Carlos, so I'm going to have you hold your arms. There you go, and pull tight. Try and pull that apart without pulling it apart. All right, you can let go. Patellar reflexes are 2 plus bilaterally. They're equal. Okay, Carlos, one important part of your health is testicular self-exam. So there's 3 risk factors specifically for testicular cancer. One is being if you are a white male. So you do fall into that category being that you're biracial, your mother is Caucasian, your father's Hispanic. So that is one risk factor that you can't change, okay? So the other 2 are undescended testicles or family history of testicular cancer. Do you know if you have a family history of testicular cancer or if you've ever had any testicular problems?
No.
Okay, so the 3 things you want to remember about testicular self-exam is timing is once a month. It's best to do it in the shower because the warm water helps relax the scrotal sac, so it makes the palpation or the feeling of the testes easier to do. And examine. You want to check for changes and report those immediately to your doctor, okay? So I'm going to give you this. This talks about what your risk is. And then this one here is teenshealth.org. So it gives you a little bit better information on how to perform a testicular self-exam, and specifically what the structures inside that you'll be feeling. You'll have a spermatic cord, and the epididymis is on the back side of the scrotal sac. It's a little bit softer than the testes, so I don't want you to mistake that for a mass, okay? So it actually even has a video on this teenshealth.org, which might be helpful for you, okay? Do you have any questions?
No.
All right. You have a great day.
You do.